Hi, I'm Dr. Brian Gray. I'm the Chief Clinical Officer at Candid Pro Clear Aligner System. Here to talk to you today a little bit about retention. So once we've delivered that beautiful, beautiful orthodontic treatment for our patients and given them that smile that they want with really great function, we want to be able to give them something that's going to keep them that way for the rest of their life. And that means they have to have some sort of retainer that's going to give their teeth a gentle reminder to stay in that position. Now, let's take a look at all the different retainer systems out there and break it down, keeping it kind of topical and high level here. We can start by saying there's fixed and removable. If it's fixed, it's something that's glued to the teeth, typically like a wire with brackets or a bent wire or something similar to that. And the goal behind that is to be a rigid fixation to keep the teeth from moving. Generally, the times that we'll use that is when someone's had periodontal disease that might be rather severe. Maybe it's because there's a tongue thrust or some other habit that might possibly push the teeth around. It could be because maybe the orthodontics isn't finished or maybe it was done poorly, in which case you'd need to have some sort of retention to keep the teeth from wanting to push back into a different position. So with that in mind, we're going to put fixed aside because typically if people have been through clear aligners, they are looking for a removable type solution. And we can really divide that into kind of four different areas. The first is something like a Holly, and a Holly is the pink plastic with the little wire on it. It's really kind of considered the standard of care as far as removable orthodontics is concerned. The reason is that they last an average of 14 years. They've got a tremendous history behind them, but they also make you look like you're back in high school with that little wire and the pink acrylic. Also, it's important to know that the reason that Hollies last so long is that what holds the teeth in place and makes them keep the smile the way that it should be is not necessarily the wire on the front. That helps a little bit. It's the scalloping of the pink acrylic plastic on the inside that locks the teeth into place. And generally, you'll see from those studies that the reason that they have to be replaced is because they're either lost or broken. They don't really wear out. They last a super long time. You see adults who have had Hollies. But as mentioned, if a patient's been through clear aligners, they're not looking for that as a solution, just like they're not looking for fixed. So it now takes us to some other removable systems that are out there. One could be a retainer in the form of a splint or a night guard. That can act as a retainer if it's made properly to hold the teeth in place. Oftentimes we use that for people who have had some sort of TMD issue or are a severe clencher or grinder. It may be that they're taking a medication. Just something to keep in mind, people on SSRIs, any type of the serotonin reuptake inhibitor groups, people tend to have a lot of clenching or grinding associated with those. And we know that probably 20% of America is on one of those at any given time. So it might be necessary to have that type of retention where you've got something thick and can protect the teeth. But a properly made thin plastic one can serve the purpose as well. So now these three remaining groups that we want to talk about, one would be laboratory in-office made retainers and in the form of like Essex or Trutane or C. The challenge with those is that one, it's expensive and time consuming. You have to go ahead and print a model or pour up a model, whatever the case might be, and then do your suck down and trim it to get a single one, and you typically destroy the model doing that. And then you've got the fit. You've got to properly block that out if you're going to do it right and trim it properly so that it fits. But that still doesn't overcome the last and biggest hurdle, which is the plastic itself. The material we know isn't that strong. We can look at some really great studies by Tim Wheeler out of University of Florida, who spent a lot of time looking at the materials associated with orthodontics and can attest to the fact that some of these fatigue in as little as 2 weeks, meaning they're not doing their job after less than even a half a month of wear. So we're not going to really consider those. We're going to now look at manufactured digital ones, and we're going to look at basically Permaform, the Candid solution, and all the others. I want to talk about, first off, comfort. Well, the other things like fixed and the Holly are not really as comfortable as the ones that are going to be made manufactured digitally, and in particular, even the ones that are manufactured in your office if you're going to be doing the lab ones. We also said that, again, the material isn't that good at having good memory. Well, that's one of the big advantages of the Permaform, is that we picked a material that we know is superior for maintaining its position and not fatiguing, giving us a really, really great long-term stability to help keep the teeth in place. Typically, we say that the Permaform retainers last about an average of a year. It's going to depend on the patient and the circumstances, but we've seen that an average of a year is about right for these. Some patients maybe sooner, some patients can get 2 or 3 years out of one of those. The idea is that we want something that's durable and going to last, and we want the patient to know when it's time to change it. Simple way for a patient to know when to change into a new one is to simply try the new one in, and if it feels really tight, it means it's time to go to it. If they put in a new one and it feels similar to the one that they're wearing currently, have them put that away and try it again in a few months to see if it feels tighter, because that means that the plastic is still holding the way that we want it to, and that'll provide a great service for our patients. So what else is a good distinguishing factor for Permaform over the other systems that are out there? Well, I can speak to not just the material, but I can also talk about the cut and the way that it's blocked out. We make it so that it's comfortable for our patients, but will retain the teeth and hold them in a really, really great position because of the trim. Again, we use more cross-arch stability by going up higher with a higher cut line than a scalloped, which will hold the teeth. We know that the scalloping breaks down and is loose and wiggly and allows the teeth to move. So I consider that a disadvantage as well. Probably one of the biggest disadvantages of the other systems over the Permaform is the cost and the ability to order 1, 2, 3, or 4. With Permaform, we can order a single one or up to 4, any combination that you want, and they come in at less than half the cost of many of the other systems, especially the major competitor out there. Taking all these things makes us want to look at Permaform as the best solution, and one that we're really proud of having developed and clinically tested amongst patients to see that it was superior to everything else on the market. Now, having said that, I think it's important for us to know the way that we can order the retainer system. It's as simple as clicking a button on the patient's site when we go ahead and want to order them. There's a little button we can click. And interestingly enough, you don't have to have it be just for patients that have had candid treatment. You can offer this Permaform retainer system for people who have had other types of orthodontics, be it fixed or some of the other removable systems out there. We have now had a number of patients come into our practice seeking out our retainer system because they found it to be superior to the other ones. They're available through the other offices in our neighborhood, in our area. We'd like to also keep in mind that because, again, we said aligners are made to move teeth and retainers are made to keep teeth from moving, that we want to be able to order those when we're ready to have patients in a nice settled position and everything being all done. So we click on that button and we can do it one of two ways. We can order from the last stage of the aligner that we used, or we can take a scan and get a new set. I'm highly suggesting that you always scan for a new digital treatment plan for the retention system, because typically something is slightly different than that final stage, but be it from restorative treatment, or maybe you did some enamelplasty or an occlusal adjustment, or the teeth have so-called settled. It's better to take that new scan. You don't really need anything else. You don't need photos or x-rays or anything to order these. Again, you don't even need to use the Candid system to order the retention system. Permaform is available for anyone. You can simply start a case and go ahead and make the retainers for a patient. Maybe it's because you want to hold them while they're in the middle of some sort of restorative treatment, etc. But we want to look at this as a really great, cool new option for our patients that we can offer them, and make sure our doctors are aware that this is a great continuation to the wonderful Candid system that we're offering now. Thanks.